Hey everyone, I'm Cole. I'm a PA student. I'm going to be talking to you today about what a PA is, a physician assistant, and educating you guys on unintentional teen drug overdose, how to access naloxone, kind of what it does, talk a little bit about the opioid epidemic as a whole, and then also give you guys different resources and information you guys can access if you guys want to follow up on it. So before we get started, I kind of want to get you guys a little familiar with myself. Like I said before, I'm Cole. I'm a PA student. I'm actually originally from Phoenix, Arizona. Some of the things I love to do is I love sports. I've been involved with it ever since I was little and actually had the opportunity to swim in college. But I moved to Florida because of the opportunity to go to PA school here. The program is amazing, and overall I do love being around the beach. Arizona, we just have a bunch of sand and dirt, so having some water every now and then actually helps a lot. And then we're going to go into the learning objectives. And these are the learning objectives. You guys can kind of glance over them, familiarize yourselves with them. This is just kind of like a template of my goals and kind of what we're going to go through learning through these next 30 minutes with you guys. So just take a look real quick and then we're going to get into the presentation. So take a look at these questions. We're going to go through them. There's going to be a link in the description below that I want you guys to access these questions, and then we're going to revisit them at the end to kind of see if there's any improvements. I want you guys to do that now, answer them to the best of your knowledge. Just take out your phone, you guys can do it real quick. So the first one is, how many people died from unintentional overdose in 2021? Then, what can be used to reverse an opioid drug overdose? And then, what are opioids? What lists of drugs are considered opioids? How does an opioid overdose kill you? And what route of entry has the quickest onset for a drug? So what is a physician assistant, or a PA? It's a licensed clinician who practices medicine in almost every specialty. The education required is a master's level program that's 27 months long and over 2,000 clinical hours. Our scope of practice is we do medical histories, we conduct physical exams, diagnose, treat illnesses, order and interpret tests, develop treatment plans, prescribe medications. We counsel our patients on preventative measures and how to take care of themselves. We assist in different surgeries. We also perform many procedures, and we even do clinical research. Healthy People 2030. So this is kind of why I'm here today presenting to you guys, is because of Healthy People 2030. It's a data-driven national objectives to improve the health and well-being over the next decade of us as a society. They have a range of different health conditions, from different cancers, diabetes, to health behaviors such as sleep or drug and alcohol use. And today our focus is going to be drug overdose on teens. So now I'm going to show you the next couple slides, some famous people who unfortunately died of drug overdose with opioids. So I'm going to show them. Hopefully you guys know who these are, and if not, I'm going to go through them and we'll go from there. And this is Juice WRLD. He's a rapper. You guys probably know him for his famous song Lucid Dreams, but he unfortunately passed away. He overdosed on Percocet pills in 2019, and he was only 21 years old. And then this artist, this is Mac Miller. He's also another rapper, known for The Best Day Ever, but he unfortunately overdosed on fentanyl mixed with cocaine in 2018, and he was only at the age of 26 years old. And then this is Lil Peep. He's another rapper known for the song Star Shopping, and he unfortunately overdosed on Xanax laced with fentanyl in 2017. He was only at the age of 21 years old. And then this is Prince. He's a famous musician, and he's known for Purple Rain, but he overdosed on fentanyl back in 2016, and he was at the age of 57. And now I'm going to stray away from musicians. We're going to go towards an actor this time. This is Heath Ledger. He's in this picture playing the Joker from The Dark Knight. Some of you may also know him from 10 Things I Hate About You or various other movies. But unfortunately, he overdosed off of a plethora of drugs, and they are oxycodone, hydrocodone, Xanax, Valium, Restoril, and Unisum, and this was back in 2008, and he was only at the age of 28 years old. And now you guys are probably wondering who this is. He was a brother to some people, he was a friend, he was a teammate, he was a son, He's literally one of the coolest dudes you could ever meet, and to me, he was my best friend. And unfortunately, he passed away in 2020. He overdosed smoking OxyContin, and he was only at the age of 25 years old. All right, so now we're going to transition from talking about people that we know or famous people that were involved in drug overdose deaths to Healthy People 2030. So they provided data from 2019, which showed 21.6 drug overdose deaths per 100,000. And so their goal for 2030 is actually to bring that down to 20.7 per 100,000. Seems a lot easier. It's like basically 1 point or one death per 100,000, but it's a lot harder than it looks. If you look at any of the graphs over the past couple of years, we've seen that it's actually been skyrocketing and getting worse and worse every year. That's why this is like a key area that Healthy People 2030 want to try to combat, because it's actually getting worse. So the next slide I'm going to go over, and we'll talk about some of the CDC data, and then we'll continue from there. So according to the CDC, we have more than 932,000 people have died from drug overdose since 1999. And then in Florida in 2020, the average age of a drug overdose was about 35 years old. It's a total of 7,231 deaths. And then here's a little chart showing unintentional drug overdose. So this is actually for Palm Beach County. That's going to be the blue line right there compared to Florida as a state. And you can kind of see that it says 43 per 100,000 deaths for Palm Beach County. And then Florida is 34.6 per 100,000 deaths as a whole. So you can see that Palm Beach County actually is way above Florida as a whole, and that this is something we need to address. So here's a table that I made with data from National Institutes of Health over drug overdose deaths. This is in 2020. I'm comparing all age groups to 15 to 24-year-old range, which is kind of our focus with like teens. So all ages is around just short of 92,000 deaths total, and then 15 to 24-year-olds is just over 7,000. Majority of them are going to be opioid related. As you can see, it's just shy under 6,000 for the 15 to 24-year-old, and then 812 are going to be prescription, and then emphasis on the fentanyl when we're talking about the synthetic opioids, which is 5,393, and then we also have heroin on there too, which is at 711. So this is a 5-year study from 2015 to 2019, which looked at unintentional drug overdose and mortality. So what they did is they formed 2 different groups. The first one is adolescents, about 10 to 19 years old, and then the next one was young people, which was 10 to 24 years old. And what they did is they took the total amount of deaths and they estimated years life lost. And so that's going to be in the at the bottom of the table. So basically it takes into account the years that each one of those deaths, like those people would have lived if they did not die prematurely. And basically what it does is it kind of puts into perspective the amount of life that we've lost that could have been lived if it wasn't for an unintentional drug overdose. Teen drug abuse. So teens are at a higher chance of being abusers when they become adults if they abuse in their teenage years. It also has it can have a long-term cognitive and behavioral effect if they abuse drugs in their teens since their brain is still developing. If the teenager decides to experiment with drugs, does that mean they're an addict or it's an addiction? No, not necessarily. And reasons for experimenting, we found that teens are curious, could be peer pressure, friends want you to try it. Some teens may be stressed out from school or situations in their life, or some people are just trying to find an escape from their current situations. And so these are some kind of signs of teen drug abuse. These are just some examples. It's not limited. This isn't exactly everything. And then 40% of teens who abuse prescription medications obtain it actually from their parents' medicine cabinet. And according to the CDC, 1 in 5 teens abuse prescription medications. And these are risk factors provided from the CDC, so family history, substance use, if parents are cool with their kids using substances, if the parents aren't even around, aren't really monitoring what their kids are doing, or if the parents themselves are using substance, or even their peers. If their peers are using substances, most likely you do what your friends do, so you're going to try it, and everyone else around you is doing it. Some of them have issues with their sexual orientation or gender identity, and they're being rejected from their family, so they want to escape, and they find substances to deal with that. Or even, let's say they've had childhood sexual abuse in the past. They find substances and they use that for an escape. And some kids are even more prone to mental health issues. And then there's that lack of school or of low academic achievement. They're not really interested in school. They're not connected with school, so they have more free time to get into substances. So this is CDC State Unintentional Drug Overdose Report System, also known as SUDRS. So May 2020 to April 2021, over 100,000 overdose deaths. 64% were from synthetic opioids, so fentanyl, majority. And fentanyl was placed in heroin, counterfeit pills, so like oxycodone, Xanax, and even cocaine. 4 in 10 unintentional overdose involved a stimulant, so cocaine or methamphetamine. And in the Western jurisdiction, 21.8% of deaths were under the age of 25 years old. And then 64.2% of deaths occurred at home, and then 34.7% of deaths occurred with a bystander present. So these are tables provided from a study in Rhode Island from July to December 2016. And the study basically looked at opioid overdose deaths, and they found that 71.1% involved fentanyl, and 83% had 2 or more substances involved in their deaths, and majority, around 39%, was actually cocaine. And majority of deaths occurred at the house or the apartment. And you guys should be super cautious because the DEA has seized more than 9.5 million counterfeit pills in 2021. Majority of them containing 2 milligrams of fentanyl, which is a deadly dose. So fentanyl is actually usually dosed in micrograms. If you're dosing it in milligrams, that could be over 100 times the normal dose. And the DEA seizing counterfeit pills with fentanyl has increased by 430% since 2019. And majority of them are like Oxycontin pills, Percocet pills, Vicodin, Xanax, and Adderall, just to name a few. Drug pharmacokinetics, that is literally just a big word to show you basically a drug movement throughout the body. So some of the methods are like oral, injection, inhalation, or intranasally. And so basically the drug is always distributed through the bloodstream. And I will go over some of these too, but you have a thing called first pass effect. So that's basically where your liver metabolizes the substance before it travels up to the brain. And then you have excretion where the drug is removed. So let's say we had a substance and we ingested it. So we did the oral route. So the substance will be ingested, and then it's going to dissolve in the stomach, and then it's going to be absorbed through the bloodstream. It's going to travel to the liver first, and then it's going to be metabolized with that first pass effect, and then it's going to be sent to the brain. So due to this process, the drug is going to go through this route and have noticeably less effect than other methods because of this first pass effect. So let's say we are smoking. So this is another route. So that basically enters the bloodstream fairly quickly through the blood vessels in your lungs, and then that travels to the brain and skips the liver. So this gives you a greater high or a higher likelihood of abuse because you have a higher concentration of the substance going straight to your brain. It's foregoing that first pass effect, so your liver doesn't even touch it. So if you take a substance, so for instance, in my best friend's case, he smoked Oxycontin, so normally that drug is ingested and it goes to the liver, and you're going to have a smaller concentration of that substance going to the brain. But in his case, he smoked it, so it skips going to the liver, and then you have a way higher concentration going straight to the brain, which gives you a higher likelihood of overdosing. So fentanyl, what is it? So fentanyl is a synthetic opioid that is 50 times stronger than heroin and 100 times stronger than morphine. It's legally prescribed by doctors to treat pain, like for instance, if you are post-surgery or you're a cancer patient, just to name a few. And illegally manufactured fentanyl is actually linked to a majority of overdose deaths. That's why one of the reasons why we see such an increase in overdose deaths, because it's 50 or 100 times stronger than what people are usually getting. And when people are putting this into drugs, it actually makes it more potent. It's cheaper to make, it's more addictive, and it's way more dangerous. And over 150 people die every day from overdose related to fentanyl. So what is naloxone and how does it work? So naloxone is a opioid antagonist, which just means that it acts on opioid receptors. So you have a whole bunch of these opioid receptors spread around your body, and when you take an opioid, basically the opioid latches onto these receptors and it allows the relief of like pain, but it also has like negative effects such as respiratory depression, so you start breathing less and less. It can be sedating, so you can get sleepy, or you can have constipation or nausea and vomiting. So what naloxone does, since it's an opioid antagonist, so it likes these receptors, it can push basically the opioid molecule off, and then it'll attach to the receptor. So it'll tell it to get off, it's going to attach to the receptor, and it's going to help reverse those negative effects within minutes. So if you have a patient and they overdose, they have too many opioid molecules attached onto these receptors all around the body, which is going to cause less and less of breathing, so more respiratory depression until you have no breathing at all, which is what is overall going to kill someone when it comes to one of these opioid overdoses. And so what naloxone does is it's going to hit it off, and it's going to reverse these effects within minutes, so it's going to help reestablish the breathing. All right, so is naloxone safe? Yes. Like I mentioned before, all it does is that's acting on those opioid receptors. So if you give to someone that is not going through an opioid overdose, all it is going to do to them is they're going to feel uncomfortable that you're spraying something up their nose or that you're giving them an injection. Because all it's doing, it's acting on those receptors. It's not causing anything. The only thing that you do have to look out for is opioid withdrawal. So if you have a chronic user of someone that uses opioids daily, and you give them, they're going through you give them naloxone, you can actually send them into withdrawals because of it. But that is better than death, so you should still give it. And at the end of the day, you're supposed to call 911 anyways after you give naloxone. And I'm going to touch on how to use it later on, and we'll go through all that. But it's totally safe. Can you be allergic to it? Yes, but it's extremely rare. Now, how to use it. So I've actually provided Narcan's website, which is a brand name of naloxone, and they have step-by-step instructions, but it's super easy. It's not rocket science at all. You're just going to take the product, you're going to peel it, you're going to take it out of the packaging, you're going to place it under the nostril of whoever's overdosing, you're going to give it a spray, and then you're going to call 911. Regardless if they wake up, you need to call 911. And then you can give them an additional dose every 2 to 3 minutes. All right, so kind of like how to get it. So if you go onto Narcan's website, they actually provide you standing orders for all 50 states, because it used to be you had to have a prescription to obtain Narcan, but now because of all the studies of coming out with it being life-saving and people having it in the house, especially if you're using opioids, there's states now where you don't even need a prescription. I'm lucky enough to be in Florida, and I've provided the link for Florida talking about all its standing orders for naloxone. I'll even go through how to use it as well. But luckily, here in Florida, you don't need a prescription to get it. And I even called my local CVS. So if you're a Florida resident, you can call, or you can go to CVS. I know for sure they have it because I talked to the pharmacist, and he said you don't need a prescription, and you can just pay out of pocket for it. And here's also like a slip that you can give. There's a screenshot on the slide here, but also I provided a link that you can print out, and you can give that to the pharmacist if there's any issues. And these are new recommendations for naloxone. Basically just goes over if you're a healthcare worker and you're working with patients that are prescribed opioids, it's good to let them know the availability of naloxone, or even what naloxone is, so they can have the opportunity to have it. especially too if you're working with anyone that has opioid use disorder, or even if you're not a healthcare worker, like if you have friends or family that use opioids, this is a good discussion to have. And then I provided a graph kind of shows overdose deaths in the U.S. from 1999 to 2019, and you can kind of see how it skyrocketed, especially with the synthetic opioids, so fentanyl. And the reason why I have this on here is because naloxone actually can reverse overdose from fentanyl, because remember, fentanyl is an opioid, so it uses those same receptors. So naloxone is a good discussion to have with anyone using any kind of substance, especially if it involves opioids. And then here I wanted to provide updates. So the FDA actually just approved a 8 milligram naloxone spray. So previously it was 2 to 4 milligrams, and the reason for this update in a higher dose is because of the fentanyl. And there's actually fentanyl analogs, which I'm not going to get into, but basically it's just another version of fentanyl. They take the chemical compound and just tweak it a little bit, and it's even more potent. So having this 8 milligram naloxone spray can actually help combat the higher use of fentanyl being circulated through the population. All right, so some signs of treatment for overdose, opioid overdose. I hope you guys never have to see this, but if you guys do, you guys are going to be prepared, and I know you guys are going to be able to act upon it, especially if there's naloxone around. So the patient's going to be unresponsive, they're going to be limp, they're going to start to have blue fingertips, blue around their lips, because remember, they're not going to be breathing. It's going to be depressed, if at all. They might not be breathing at all. If you go to check their pulse, it's going to be slow or irregular, and if you look into their eyes, their pupils are going to be pinpoint. So yeah, don't panic. You're going to remember what I taught you today. You're going to find the naloxone if it's around you, and you're going to administer it, and then you're going to call 911. So this is a study on take-home naloxone. It was actually done in Australia, and it looked at the importance of simple initial training compared to repeat training on naloxone. And so what they did is they took 145 participants, and they had a 3-month follow-up. And they basically chose people that were at risk of overdose, or people that used alcohol and drugs, or people that were a part of a needle exchange program. And so basically what they did is they took these people, they gave them a simple instructional video of how to use naloxone and kind of what it is. And they also found out which of the participants had prior knowledge of take-home naloxone compared to people who didn't. And basically what it did is they just found the importance of the simple discussion and demonstration of naloxone was sufficient enough to increase favorable outcomes of overdose in the future. So regardless if someone had previous knowledge of the take-home naloxone, as long as you give them that initial simple, straightforward little training of what naloxone is and kind of how to use it, that was sufficient enough to have a favorable outcome in the future if there were to be an overdose. So this is a study done in Baltimore, and it basically just talked about the access and barriers to take home naloxone. And so what they did is they took 165 patients from the emergency department who misused opioids. So basically 71% of them knew about take-home naloxone, but only 57% had access to take-home naloxone or even had a prescription to it. And then people who received the prescription, there was only 23% that actually got a prescription for it. And then of that 23%, only 64% actually filled it. And then if you look at them as a whole, only 60% even knew how to use naloxone. So you're still missing out on 40% of patients who probably had it and had no idea how to use it. So this kind of just highlights gaps in knowledge and access and use that exists when it comes to naloxone. So there was a study done in New York that took heroin users and people that use it, like methadone or buprenorphine in certain programs. And what they did is they gave them naloxone and they gave them overdose training. And they were screened to meet the criteria. So obviously to be a part of this, they needed to have opioid dependence. And what they actually saw was a decrease in heroin and polydrug use after training. So as you can see from these charts, they had to do different follow-ups. So for instance, they had 1 month follow-up and 3 month follow-up. And they actually saw a decline in the amount of drug use after the training with naloxone. Because there's this thinking that if you give a drug user naloxone and you teach them, hey, this is going to save you and reverse it, that they're going to use more. But according to this study, it actually showed the opposite effect, that it actually decreased the use of the substance. So here's another take-home naloxone study. This was done in 2016 through 2017 in New Mexico. They had 395 participants. They all had opioid use, a history of opioid use, and they actually had taken these participants and they trained them of what naloxone is, kind of how to use it, how to administer it, all that stuff. And what they found is throughout this year-long study, they actually had 114 overdose reversals in the community from these participants, and majority of them were reversals from heroin. And it had such a big impact on the community that the New Mexico legislation actually passed a bill that mandated overdose education and take-home naloxone, along with a prescription of naloxone to each patient in opioid treatment program. And every inmate that was incarcerated and leaving that had a history of opioid use. They also mandated that every New Mexico police officer carry 2 doses of naloxone while on duty. And here are some of the Florida statutes. And so you're probably wondering, what the heck does this mean? And so basically, in simple terms, if you need medical assistance or someone you know or even yourself and it's drug related, like whether it be illegal or legal, you will be protected and you won't be penalized. So like if you go get medical help and you think you're having an overdose, or your best friend took a pill and now he's acting funny and he's not breathing right, and you think it's an overdose, you can go take him to get medical assistance or call 911, and you won't be arrested, you won't be charged or prosecuted for having taken that substance. All right, guys, we made it to the end. So now we're going to take the post-presentation quiz. So that's going to be in the link in the description below. So you guys can pause the video, and then when you finish, return to the video, and then I'm going to go over them right now. So the first question was, how many people died from unintentional overdose in 2021? So the choices were A, 100 million, B, 10,000, C, 100,000, D, 1,000. And so the answer is going to be C, 100,000. The next question is, what can be used to reverse an opioid drug overdose? A, Flonase, B, lavender, C, oxygen, and D, naloxone. And the answer is going to be D, naloxone. And the next question, what are opioids? So A, prescription medication to treat pain or street drugs like heroin. B, drug class related to marijuana. C, anabolic steroids, or D, drug class related to cocaine. And the answer is going to be A, prescription medication to treat pain or street drugs like heroin. All right, for the next question, what list of drugs are considered opioids? So your options are A, marijuana, hemp, spice, tobacco. B, heroin, Percocet, morphine, fentanyl. C, cocaine, methamphetamine, ketamine, LSD. And D, ibuprofen, Tylenol, Aleve, and aspirin. And so the correct answer here is going to be B, heroin, Percocet, morphine, and fentanyl. The next question, how does an opioid overdose kill you? A, stops your heart from beating. B, stops you from breathing. C, causes a seizure. Or D, melts your brain. And the answer is going to be B, stops your breathing, because remember, it creates respiratory depression, so you breathe less and less until you're not breathing at all. The next question is going to be, what route of entry has the quickest onset for a drug? And so the first one, A, is smoking, B, ingesting, C, snorting, and D, injecting. And so the answer here is going to be D, injecting, because remember, when you inject something, it doesn't have the first pass effect where it goes to your liver, gets metabolized, and then goes to your bloodstream. So you're going to have a higher concentration because it goes directly to your bloodstream and it's able to go straight to the brain. And so the answer here is going to be D. And that's it for the presentation. I wanted to say thank you guys so much for sitting through it. Hopefully you guys learned something and can apply something you learned today in your day-to-day lives. I just want to say thank you so much. And then here are all my references. This is kind of where I got all my information, my research. So if you guys have any questions, you guys can look through this stuff too, or I can even put my email or something down for you guys to email me, and I can get back to you with any questions that you guys have. Thank you.